December is flu vaccination month, so we're here to talk about the flu. I know you've been hearing a lot in the news, COVID and one virus, but we're going to talk about a different virus today. We're going to talk about influenza virus, the flu virus. And I'm happy to have with us today my doctor, my personal doctor, Dr. Manny Gonzales. Dr. Manny Gonzales is a primary physician down here in South Florida in the Kendall area, and he's going to join us today and talk to us about the influenza vaccine, also known as the flu vaccine. So, Manny, thank you for having.
Thank you very much.
All righty. So, Manny, why don't we start off? Just tell the audience a little bit about yourself and where you are from and what you do, so they can be a little oriented about who's speaking to them today.
Okay. I am a primary care physician that has been in practice for 20 years down here in Miami. I was born and raised in this area. Went to medical school in University of South Florida, trained in the St. Petersburg area in family medicine, have been board certified, and have been part of this community for 20 years.
All righty. And so obviously you deal with patients who have questions. And as a primary physician, you have patients who come in, and I imagine you tell every patient that should have the flu vaccine. Is that right?
Absolutely.
And why should a patient get the flu vaccine?
I mean, influenza is has a significant morbidity and mortality. Obviously, what we're dealing with at this point in time with coronavirus is never been seen. But influenza has significant mortality. I remember a case not that long ago, about a year ago, that I had this little old gentleman that never received the flu vaccine, and he actually got influenza, got very ill, and almost died. Nonetheless, tens of thousands of people die every year from influenza.
Wow. Okay. So how do I know if I have the flu? I remember once I called you and I told you I have a cold, Manny, and I think I have the flu. And then you asked me just some simple question and you go, no, you don't have the flu. How do I know if I have the flu versus just a common cold?
Well, nowadays we actually have the nasal swab similar to coronavirus that actually can test for both influenza A and B. In addition to that, usually most people will have severe body aches. It feels almost like you got hit by a truck. You also have fevers, usually 102 or higher when you do have influenza.
All righty. And so now we're in flu season, right? That was the concern. I remember hearing on the news about COVID and now the flu vaccine coming, the flu coming, and this season. So when is flu season occur?
Flu season usually is basically between November and February. We start immunizing as early as late September is when we start our immunization, and ends at about February or March.
All righty. And so now you have to get your flu vaccine. So when is the best time to get the flu vaccine?
Now.
Are we late already or right on time or?
Now. I mean, if you haven't gotten it at this point, get it.
All righty. And so I got my flu vaccine, but every year I have to get a new flu vaccine. Why a new flu vaccine every year?
Well, the strain actually changes every year. And if you do get your flu vaccine every year, it has been found that the people that do get it repeatedly yearly actually have a better efficacy or better effectiveness of the flu vaccine.
Wow. So there seems to be like a cumulative effect.
Correct.
Of all the strains. So we're getting different strains of every of the viruses, and they pick them up. Year. And how do they know which strain is going to be this year? Or are they just using the previous years?
They use the previous years and they try and predict what's going to happen this following year.
All righty. And so I get the flu vaccine. Can I get the flu from the flu vaccine?
No. That's actually very incorrect that you can get the flu. It is an inactivated virus.
And am I going to feel anything? I mean, when I get it, I just get like a pain in my arm, but I actually do it between my surgery. So I go to surgery. They have the flu vaccine in the cafeteria. I get my flu vaccine and I go back to surgery. So I don't feel anything.
There are adverse events. And actually that's how you can tell that the vaccine is working, because you do form an immune response. So you do form antibodies. And in that response, you may get myalgias. You may get like a little bit of temperature, not an overt fever, but you can have some malaise from the vaccine itself.
All righty. And now with this whole thing of COVID, how does that relate? I mean, is the flu, I don't think, and I'll answer this as a surgeon, I don't think the flu vaccine is going to protect me from COVID, but is it going to interact with maybe the COVID? I'm waiting for the COVID vaccine that's coming out like in a couple weeks. Should I still get the flu vaccine? Tell me, how does that interaction play?
Okay. Yes, you should still get the flu vaccine. Okay. The flu vaccine is not protective in any way, so far as we know, for coronavirus. However, there is one very, very strong fact that if you happen to get coronavirus and influenza at the same time, it is about a 2.2%. I think it is a 2.2%, or sorry, 2.2 fold worse mortality rate for the coronavirus when you have it in conjunction at the same time.
Yeah. So if you're as unlucky to get both of them, your mortality rate
That
is
is correct.
high, double. So you're twice as likely to die if you get COVID. And so someone young, because we're young, you and I are young, and if we get COVID, of course, it should be okay. But if you have the flu as well, it'd be really detrimental.
That is very true.
So what about an allergy? Can you have an allergy to the flu vaccine?
There have been cases of people that have had allergic reactions to the influenza vaccine. Obviously, that's very few people that have ever had a significant allergy. But if they have had the flu vaccine and have had an anaphylactic reaction or severe hives, they are recommended not to have the flu vaccine.
Okay. So how do we get the flu vaccine? Do I have to go to my primary doctor? Some people say they'll pay me to get the flu vaccine. I can get paid to get the flu vaccine.
I don't know about getting paid. But the flu vaccine, there are so many places to be able to get the flu vaccine. It's available. All primary care doctors will have it. In my office, people are asking me for it, which is a phenomenal thing with what's going on this year. You can get it at any of the pharmacies. I know that Baptist Health also is offering it as well. And I think they offer it free of charge as well. It's everywhere.
So it sounds like there's really no excuse. I mean, you should get it. It's going to protect you. There's no cost. The reaction, really, there is no reaction to it. And so what about the ages? I mean, should small little kids get it? Should elderly people? I know that, my mom, as you know, she's your patient. She's got respiratory problems as well. And so, of course, influenza, respiratory problem. What are the age limits as well of the flu vaccine?
Well, I know that I actually had to research this because I haven't taken care of children in a very long time. But it's 6 months of age and older. Definitely pregnant women are also indicated to get this since they are considered to be immune compromised, and absolutely the elderly and everybody in between.
So really everybody over the age of 6 months should get it.
That is correct.
So now I get the flu. What should I do? Now, you have COVID, you stay home, you quarantine in a bedroom, you don't give it to your family, you wear a mask. I mean, what do I do if I have the flu? How do I know I have the flu? And what do I do when I have the flu?
Well, first off, if you actually have ever had the flu, you almost self-quarantine because you feel horrible. So you tend to be in bed for approximately at least 3 to 4 days. And then you would stay away from other people for about a week.
Okay. And you should wear a mask?
Yes. If you're going to go outside. If you happen to be strong enough to be able to go outside, yes.
And wear the mask for a week at least?
Yeah.
Okay. And so I get the flu. So if I got the flu, does it protect me from the next flu? Can I get multiple flus in one season?
I mean, it's possible, but there is some protective effect after getting influenza to not get it a second time.
Okay. And then I get the flu shot. So I got the flu shot. I think I got mine in October. I would assume by now it's been a couple months. How long does it take for us to develop an immunity and get the flu, get the protection
get the
from
antibodies? It takes about 2 weeks. 2 weeks after the immunization, then you're considered to be protected against influenza.
Okay. And then how about pregnant women? Or should a pregnant woman get the flu shot?
Absolutely.
Wow.
Yeah, the nuances in there, actually speaking to some of my colleagues, they say usually after about 12 weeks is when they do the influenza vaccine, but absolutely, they definitely need the influenza vaccine.
Wow. And so in general, everybody should be getting the flu shot, except if you're 6 months or age. Of course, if you've had an allergic reaction to it in the past, you shouldn't get it. You should be getting it year after year. That's what I'm hearing from you.
That is correct.
And if somebody comes into the hospital and they're ill, do they get it at that time?
No, not during the time with an acute illness. They actually have to wait until they're well again.
Okay. All righty. And
that's a great question.
Okay. And then what about, there was this famous thing about autism and autism related diseases. Don't vaccinate your kids, because of the development of autism and so forth. Then we learned later on that was all, erroneous type of research. Talk to me about that.
I mean, there's been research into this repeatedly. There is no higher incidence of autism in people that have been vaccinated than in the general population. And that's just statistical analysis. The unfortunate reality is that other diseases occur, and they usually occur around childhood, or they're diagnosed around childhood when a lot of vaccines happen to be given.
And so if somebody has the flu, they're quite sick. Of course, you said they're in bed for the first 3 days. So obviously they're not going to be at work. Do they call their doctor? Do they go see their doctor? What is the treatment?
Actually, there is several treatments. The most common that we're using at this point in time is Tamiflu, and that's significantly shortens the duration of the disease as well as the symptomatology.
So do you diagnose them before, or do you do this over the phone? Or now there's this whole telehealth, where patients are seeing their doctors through their phones or through their computers. What happens there?
Well, the one benefit of what's going on with respect to the social distancing and masks is that there has been a significant decline in influenza because of that. I haven't had that case as of yet this year, but it's possible. I have diagnosed people with influenza or high likelihood of influenza and have treated them with Tamiflu over the phone.
Over the phone. But then you should be, so if somebody comes to the office, they're not that ill, you swab them first and then you give them the medication, or?
Well, at this point in time with coronavirus, it's a kind of a sticky situation because in most primary care offices, we may not be seeing upper respiratory infections and reserve those for places that are more prepared, such as urgent cares that have the appropriate PPE to take care of this issue in the setting of a coronavirus pandemic.
Yeah, that brings to me another concern. So one of the things we saw as physicians is that nobody was seeking medical care during COVID, during this pandemic. And, the likelihood of dying of a heart attack was higher. We saw people coming in with more advanced surgical problems, like perforated gallbladders and perforated appendixes, because they didn't want to get care. So if you are sick now, and of course, should you be going, like, if you have possible flu, you should go to an urgent care, or you shouldn't, or
yes.
Yeah.
I mean, in settings that have appropriate PPE to be able to handle coronavirus, yes, you should go to these centers in which they are very well equipped to be able to isolate the people with respiratory illnesses, as well as have the appropriate protective equipment for the nursing staff as well as the physicians.
Yeah, no, that's what I've seen. I've seen that this fear of not wanting to go to the hospital. And so this has scared everybody away this year because they think they're going to catch coronavirus at the hospital, where, between you and me, and that as well, it's to say one of the safest places to be, where everybody's very well protected, and we're protecting each other, and we're protecting the patients as well.
As well as everybody that gets admitted over at our hospitals get tested. I actually feel safer at work over at South Miami Hospital than going to, let's say, even my own office, because what walks in, you can't necessarily tell. Whereas at the hospital, everybody's tested.
Yeah. No, I tell people they worry about the hospital. I said, you're more likely to get it at I'm not going to say a big department store or a supermarket, without naming names. You could be likely to get it because of that. All right. So we should get the flu vaccine. Everybody should be vaccinated. You should be getting it every year. There's really no fear except for the flu itself. And of course, the people that are most susceptible are the older people and people with respiratory problems. Is that right?
And the very young.
Absolutely. And the very young. So kids.
Yes.
Wow. Okay. And the mortality, what's the chance of dying of getting the flu vaccine? For the death rate of the flu.
Of the flu vaccine?
No, the flu vaccine. I'm sorry, the flu.
I mean, it is under 1%. But obviously the very young, where coronavirus, the very young don't necessarily get as sick. Influenza, the mortality is still under 1%. But if you're in that 1% and in that section, it's devastating.
Wow. Okay. And then Corona, we're still seeing, Sid, there's another spike here, of course, in South Florida, and we're seeing more and more cases of it. What can you tell our audience about Corona and COVID, and now this other spike that we're having? Any advice for our audience?
I mean, just keep on washing your hands, wearing your mask, socially distancing, being intelligent about it. Okay. And not exposing yourself unnecessarily. Getting enough exercise, being out. You can go outside, go outside and do your exercises, because that's important, that if you do get it, to be able to survive it.
Oh, wow. Yeah. No, we've seen it has to be the definitely obesity has been one linked to one of the areas of mortality, as with age and older people as well. We thought early on that the kids weren't going to get, they were protected from corona, but that's not really the case anymore.
That's a very difficult question. That's not, but they have a significantly decreased risk of having severe disease. But there have been a few cases in where there have been deaths.
Wow. So sad. All right. Well, we've covered the flu vaccine and we've covered influenza. And obviously, it's been a topic that's kind of in the background because of COVID this year. And I think Dr. Manuel Gonzales has done a great job in covering it for us and giving us an overview. I want to thank you for being with us here today and giving us the opportunity to understand that we need to be vaccinated and get vaccinated, because if not, it could be obviously doubly worse if you get COVID. So even a more of an important year. Any parting pieces of advice for our audience?
To get vaccinated now, particularly if we do have this coronavirus vaccine that's being approved in a very short time, so that we already have the immunity for influenza before we get the coronavirus vaccine.
Great. Well, thank you for joining us again today at our Miami Community Health. And we hope to see you next time with our next important health topic. Have a great day.